Bismillah ar-Rahman ar-Rahim. So today we are going to study about the one of the most important topic in the cardiovascular pathology, and that is acute rheumatic fever and the rheumatic heart disease. So let's start. So what is acute rheumatic fever? It can be defined as acute immunologically mediated multi-system involving the joints, skin, CNS, and the heart. And when it involves the heart, it is known as the rheumatic heart disease. Non-separated, i.e., there is no pus formation, inflammatory disease. It is acute, as mentioned in the name, immunologically mediated, multi-system, non-suppurative inflammatory disease that mainly occurs after the group A beta hemolytic streptococcal infections, and it mainly in the form of pharyngitis. Group A beta hemolytic streptococcal infections in the form of pharyngitis, then it causes the acute rheumatic fever. Now talking about its epidemiology, so acute rheumatic fever mainly occurs in the children, and it mainly occurs at the age of about 5 to 15 years of age after 2 to 3 weeks after the episode of streptococcal pharyngitis or strep throat, as we have already discussed. So it mainly involves the children of 5 to 15 years of age. Now talking about its etiology, the causes and the pathogenesis behind the acute rheumatic fever, that what are the reasons behind the acute rheumatic fever, how does it causes. So let's start. Is this acute rheumatic fever is multifactorial. So the first one is the environmental factors, and it mainly in the form of like overcrowding, low socioeconomic status, and the tropical and subtropical climate. So when these factors are present, so the occurrence of acute rheumatic fever is much more. The second important factor is the host susceptibility. So some people are more susceptible to develop the acute rheumatic fever, and those people have the following factors, like they have positive family histories, i.e., the occurrence of acute rheumatic fever in the family, and those which are identical twins. The third one is those individuals which have HLA class 2 alleles. And the fourth factor is that individual which has alloantigen from D8 to D17 on the B cells. For example, this is the B cell. So this B cells contains alloantigens, and when this alloantigens is from the D8 to D17, so these individuals are much more susceptible of having the acute rheumatic fever. The third one is mainly the immunological mechanisms, and that may be in the form of cross-reactivity between the epitopes and the components of bacteria and the host. Cross-reactivity between the epitopes which are present in the components of bacteria and the host. The second one is the molecular mimicry, because the bacterial M protein, the bacteria has a protein which is known as M protein, and this M protein resembles the proteins in the human tissue. So when antibodies are formed against this type of M protein, they also react against the cell proteins which resemble the M proteins in the human tissue, and thus cause the acute rheumatic fever. And these M proteins and these proteins which are resemble the M protein are mainly present in the cardiac tissue. The third one is the autoimmune reaction, and this is due to the formation of autoantibodies against the cell organs or tissues. The fourth one is in the form of exaggerated T cell response against our own bodies. So these are some immunological mechanisms, as we have already discussed that acute rheumatic fever is an acute immunologically mediated. So these are some reasons like cross-reactivity, molecular mimicry, autoimmune reactions, and exaggerated T response of an individual which have much more chances of having the acute rheumatic fever, and this is the pathogenesis behind the occurrence of acute rheumatic fever. The fourth one is the recurrent streptococcal infection. So those which have recurrent streptococcal infection has much more chances of having acute rheumatic fever, and this recurrent streptococcal infection can also cause the chronic rheumatic fever, which we will discuss in the other lecture. Now, let's talk about the diagnosis and the clinical features of acute rheumatic fever. So this acute rheumatic fever can be diagnosed based on the basis of Jones criteria, and this Jones criteria can be defined as when there is evidence of prior group A beta hemolytic streptococcal infections, as we've already discussed, for example, elevated anti-streptococcal O antigen or anti-DNase B titers. These are the anti-streptococcal or antibodies or anti-DNase B titers. These are the antibodies which are formed by our bodies, by our immune system against the bacteria, i.e. the group A beta hemolytic streptococcal infections. So the presence of or the elevation of anti-streptococcal or antibodies or anti-DNase B titers, and with the presence of major and minor criteria. So when these criteria are fulfilled, then the patient can be diagnosed as the patient of acute rheumatic fever. So what are the major and minor criteria? The minor criteria include they are non-specific and include the fever and elevated ESR. What are the major criteria? So the major criteria includes the diseases like polyarthritis, migratory polyarthritis. And what is migratory polyarthritis? It is the swelling and pain in the large joints like the wrist, knee, and ankle joints that resolves within days, and they may migrate to involve the other large joints. So that's why they are also called migratory. And the important point is that this polyarthritis is transient. This is transient and migratory. The second important feature of major criteria is in the form of pericarditis. So what is pericarditis? Pain mean the whole. When the whole heart is involved, then it is called pericarditis. For example, in the form of endocarditis, myocarditis, pericarditis. As the heart has three tissues, three layers. The one is the endocardium, the second one is the myocardium, and the third one is the pericardium. So when all these three structures are involved, then it is called pericarditis. Endocarditis is in the form of the vegetations, and it involves mainly the mitral valve, then the aortic valve, and there are small vegetations along the lines of closure of mitral valve, and this can lead to the regurgitation. Myocarditis is the most common cause of death during the acute phase. In the pericarditis, this leads to the friction rub and the chest pain. So these are some features of the pericarditis. The third one is in the form of subcutaneous nodules. The fourth one is in the form of erythema marginatum. These are annular non-pruritic rash with erythematous borders, and it mainly involves the trunk and limbs. The fifth one is in the form of Sydenham-chorea. And what is Sydenham-chorea? It is rapid involuntary muscle movements. As you can see, these are the erythema marginatum involving the trunk, and these are the subcutaneous nodules mainly present on the bony prominences. For example, this knee, forehead, and this is the back of the patient. So these are subcutaneous nodules, and these are the erythemus marginatum.